few sectors as sensitive to media commentary and public opinion as the health services sector. And in this episode 2 of Health Leader TV, we look at how time and budget pressures are being overcome by a fresh new approach to delivery, quality and standards. For many hospitals, it's the emergency department that attracts most attention, particularly when high demand for services leads to longer than ideal wait times. Mike Sexton investigates the doctor-led organisation Care 24/7, whose collaborative emergency department model is promising an efficient and profitable alternative.
We know EDs and presentations are growing kind of 6 to 8% year on year. That's never stopped. So I think we're in that space to really make a difference.
This is Calvary Adelaide, the largest and newest private hospital in South Australia. It opened its doors here in the Adelaide CBD in January of 2020. While there's 345 beds up there, for many of those patients, the front door of this hospital is here at the emergency room. And while this ED looks like many others around the country, there's a significant difference in the way it's administered. That's because both here at Calvary Adelaide and at Buderim Private Hospital on Queensland's Sunshine Coast, the emergency department service is run by a company called Care 24/7.
Care 24/7's main value proposition is in our name. We provide care 24 hours a day, 7 days a week.
The founding director of Care 24/7 is Dr. Sharat Pandit, who's worked for decades in emergency medicine all over the world, including the UK, Germany, the United States and Australia.
We staff the emergency department with specialist emergency physicians. That takes a whole lot of stress out of the executive, who are actually quite busy running the organizations, running hospitals.
And anything changes around that shoulder, like notice bulging or redness or feeling heat.
Care 24/7 recruits and retains emergency doctors. It manages governance, HR and rosters. It's also developed business intelligence tools to report and monitor the performance of the ED, while connecting patients with specialist services through the hospital.
They're highly trained emergency medicine specialists. They come at a cost, and being able to manage that workforce is quite a challenge as well. So that's probably the number one challenge for the hospital at the moment.
At Calvary, the ED is not seen as an outsourced department, rather a partnership.
We have a number of partnerships with all types of people on our site, but 24/7 are really important to us. We expect them to provide medical care consistently and of a high standard to all patients that present, and then I rely on them for some advice.
We don't see this as basically an us or them type of approach to it. It is actually a fully integrated emergency medicine department. For all intents and purposes, we are part of the hospital system itself. And we do add value to the hospital in that space.
An example of the partnership benefits came during the early days of COVID, when elective surgery was cancelled and infection control was paramount. One channel that remained open for admission flow into the hospital was the ED, and Care 24/7 worked to put patients through while managing COVID risk for the hospital.
Without those relationships, we couldn't have had those tough conversations and or work with the hospital executive to optimise the emergency department and the presentations through to the hospital as well.
It's very rare that you get a thank you or a geez, whereas that happens to us every day.
After 20 years in the public system, Dr. Mike Natale is now Medical Director of the Buderim Private Emergency Centre.
It's always interested me, the private side of things, not unlike any of the other subspecialties, that you actually have your own patients, you get to draw pictures, spend some time, and really build an environment where we can provide the best patient journey and the best patient care, and not cut any corners, not be forced by the system to cut those corners.
In both hospitals, data is gathered to measure the patient's experience within the ED. This is measured from the front of house interaction through the clinical experience with both nurses and emergency doctors. It provides insight into areas that the teams are doing well, but equally provides great improvement opportunities to ensure that Care 24/7s are always first class.
ED is the front door to the hospital, so I expect those medical doctors to sit on some of my governance committees in the hospital, which is really around mitigating risk for patients and providing really good outcomes. As I said, things don't always go the way you want them to go, but sitting around a table and discussing them for learnings for opportunities or improvements is really important, and 24/7 do that with me often.
The patient traffic isn't as frantic as at public hospitals because Care 24/7 doesn't offer treatment for level 1 trauma or mental health. In the meantime, the partnership that meets at 2 hospital front doors continues to evolve.
That's why we're building partnerships with hospitals who are keen to do this so that we have the resource and we can actually do our job properly. Everybody's happy to be busy. They just want to go home and feel like they did their job. And it's really rewarding. It's a pretty cool job.
The health services sector has always been driven by an uncompromising commitment to quality and the highest possible standards. But when caught between the forces of growing demand and available dollars, this can be a difficult balancing act, especially for busy hospitals. We talked to leaders in the sector about how they're meeting that challenge.
We have to be seen as agents of change.
Look, there's a real recognition that we have to prepare leaders for the world as it will be, not as it is. And there are certainly great minds who are saying that in the West in particular, we're entering an era of scarcity. Health economists, business leaders are saying, that we may not have the resources, we may not have even the financing to actually deliver what we've done in the past. And COVID's just compounded that. So in the words of someone like Thomas Kuhn, I think we might be facing a revolution rather than an evolution in how we deliver healthcare.
We haven't done, I think, a good enough job about making sure that the training in our universities and vocational training places match the demands of the sector. So that really needs addressing. An example was the new Curtin Medical School that opened, a few years ago. I mean, people said we don't need any more doctors. Well, we actually do, and we're lucky that we started that 10 years ago. So it's a pipeline. It takes a long time sometimes to prime it, but there are going to be ongoing challenges in this space.
I think the most significant at this time is obviously workforce. We have a real gap in terms of skilled workforce, but also the unskilled labour market who are moving into different industries because it's not really competitive in aged care. We then have the issue of consumer choice because as we age, we're all wanting different things and demanding it of our both healthcare and aged care services.
For Aboriginal communities living in remote and rural Australia, these challenges that we see are due to the geographical spread because we are a long way from many of the health services from the metropolitan areas. We see many challenges here in the cost of delivering services out to our communities and out to our regions. And we also see that many of our communities are taken away, many of our people are taken away from communities, and that creates many other issues in being able to access high quality care in the metropolitan area.
So we've had a whole raft of variation across New Zealand. 20 different district health boards meant we did lots of things 20 different ways. And what we're hoping to do is that we will reduce variation. So we will take the best of breed and actually be able to provide a better service to all of the population, but we'll also be able to join up the services so people will have better access to the same high quality care regardless of where they live. So there's a whole raft of advantages we're looking to build on and the opportunities we think are significant.
Resources are ever tighter, and it becomes easier for those in most need to fall through the cracks in the system. Natalie Wynne reports from the Sunshine Coast in Queensland, where an organisation called Sunny Street is removing some of the barriers to healthcare for those in need. An idea that began in a car boot is now turning lives around.
Love, kindness, and not a hint of judgment. This is the moment Patrick Bramwell thought may never come for him, a moment that Sunny Street helped to deliver.
Sunny Street was there, and they were the only one that actually listened to what was going on and what was there instead of being governed by the red tape.
Pat should have been enjoying his later years in life, but like tens of thousands of Australians, he found himself living rough. And just when he thought there was no light at the end of the tunnel, he came across Sunny Street.
Just to be there and sit there and talk to you and listen to you instead of saying, time's up, goodbye, and that, they just opened up and they were more like a family, a friend, and that, not medical practitioners.
He's one of thousands the Queensland-based organisation has been a lifeline for.
There's so many barriers to accessing healthcare at the moment. Quite often people have lost their jobs. They've lost heart and hope, and they don't often have the supports, so the emotional supports, the family support and the systemic supports that quite often we do, and they feel quite disenfranchised and lost, and they don't know what to do with their life and their health, and that's what we're here for.
On Tuesdays and Thursdays in this Maroochydore car park, the hungry, homeless, injured or sick gather.
And a lot of these people are really after an opportunity to get something to eat, to sit down, feel connected with somebody. There's an increasing amount of loneliness that we're seeing, especially post-COVID, but also people who want to come and actually engage for healthcare reasons.
These are the people that society frequently forgets. They're looking for someone to listen, for chronic disease specialist care or Indigenous care before their problems worsen.
Often our patients don't get medical care, so by the time they do come to us, they've had weeks, months, years of health conditions that have been unmanaged and untreated.
Sunny Street began in 2018 in CEO Sonia Martin's car boot. The organisation receives some federal funding. Its flexible and innovative approach to healthcare is delivering value above measure.
We supported Sunny Street because access for health services for the most vulnerable, homeless people and people who can't afford healthcare is so important.
Sunny Street is an award-winning benevolent organisation run as a business that could help contribute significant savings to Australia's public health system.
It's just the most amazing service, and I think that we need to encourage a lot more in our health system, because they're the people we need to keep healthy and avoid them going to hospital, which is a very expensive alternative.
Sunny Street has grown exponentially since its inception, covering the Fraser Coast down to Brisbane, hundreds of kilometres and thousands of patients, and there's plans to go nationwide.
The Sunny Street model should definitely be continued to be funded because it meets the needs of our very vulnerable population, has a high Aboriginal and Torres Strait Islander people coming to the service, and they come here because they feel comfortable. So keeping people out of hospital, which is an expensive alternative, the value for money for Sunny Street outweighs what would happen in a hospital setting.
Practitioners are creating a trusting and welcoming environment to bring back those who otherwise may have fallen through the cracks.
I think people come back to us because it's safe, they get great professional holistic care. We have services within a service, so they can come to us and we can do it all there.
A bright pink bench sits in the heart of Maroochydore. It's a place of solace and hope at the entrance to Sunny Street. There's a place to rest, familiar faces, a meal and medical treatment. For all who thought there was no place to turn, Sunny Street is there, making an impact.
They have improved my life by at least 150%.
The award-winning business bolstered not by their many acknowledgements, but by the smiles they've created, the lives they've changed, through a sustainable and caring, one-of-a-kind service that could be a game changer for our public health service.
And that wraps up this episode of Health Leader TV. But you can review films and interviews from this and other episodes on the ACHSM website. Thanks for joining us, and see you again in the next episode, which focuses on leadership and resilience in health services. Until then.